Hey everyone, Dr. Paul here. I'm here with Rachel, who's 38 weeks pregnant. We're going to be doing the Webster technique today. The Webster technique is not just for pregnant people, it's for any weight-bearing individual. It is a highly specific and gentle chiropractic analysis and adjustment that focuses on balancing the nervous system, balancing the structures of the pelvis like the bones, muscles, and ligaments, and optimizing pelvic function for your pregnancy and for birth. So with all chiropractic adjustments, our main focus here is to improve the nervous system for your body's function. Now, when we do that in mom, we can hope to have those same results for baby. The main focus of this principle, of this technique, is going to be on the pelvis. When we balance the pelvis, we're balancing the structures like the muscles and ligaments that attach to the pelvis. In pregnant women, when we don't balance the pelvis, that uneven pulling on those muscles and ligaments may prevent the baby from getting in the best possible position for birth. So I'm going to have Rachel go face down on this table. I'm going to drop this piece down to give her more comfort. And I'm going to have you go face down. So the first thing we're going to check with this technique is the legs. So we want to see if there's any sort of resistance here in these legs. If the sacrum is rotated in any direction, one of these legs will be a little bit more resistant. That gives us two things. The first one is a reference point for me of where to go for this technique. But the second is the opening of the clinical picture of what's happening with her pelvis, since the sacrum is the keystone to that pelvis. Now, I'm sure you've probably heard, Rachel, of the parasympathetic and sympathetic nervous system. So the sympathetic is our fight or flight, and the parasympathetic is our rest and digest. There are certain areas in the spine that allow us to incite those two branches of the nervous system, and the sacrum is an area where we can incite the parasympathetic nervous system. So that same calmness that we were talking about before, we can address by addressing the sacrum. So another thing that is important to discuss, Rachel, is during pregnancy, people ask me how a lot of times do misalignments happen. So obviously we have a baby growing inside us, so things can shift and change, but there's a hormone that's released during pregnancy called relaxin, and it does exactly what it says it's going to do. It relaxes the soft tissues of the body to support the growth for the baby inside. Now, when the soft tissues start to relax, the bones can have a little bit of an easier time misaligning from each other. But on the same side of that coin, a lower force technique, like the Webster technique, can have profound results with a lot less force. So right here, we're releasing the psoas. So the psoas is kind of like our suspenders, but instead of going over the shoulder, it goes from the lumbar spine directly over the pelvis and attaches to the legs. Now, with a baby growing, we can have a little bit of imbalance and unevenness and compression on one of those sides of the muscle. A lot of moms come in with lower back pain, and of course, with a growing baby, we're going to have some sort of lower back discomfort, but if we can mitigate any sort of that, it would be great to do that. So if there's one side that's tight of the psoas, since it attaches directly to the lumbar spine, it will pull on the lumbar spine. So we want to make sure that these are balanced from side to side. So right here, we're contacting the round ligament. So the round ligament is really important in this technique because if one side of the round ligament is tighter than the other side, it can add torque to the uterus and further off-center it. The normal job of the round ligament is to keep the uterus from going backwards, so it holds it forwards. And in doing that, it keeps the baby's head off of the cervix until it's ready to be born. So it's really important through pregnancy to make sure that we're balancing these two sides of the round ligament, but especially during the later parts of term. So we're not showing the entire protocol of Webster, but the main thing we want to do is communicate how soft and gentle it is. We don't want to add unnecessary stress and torque and tension to the mom. We want to provide them with minimal necessary force to make these big impacts and allow their body to move forward. The whole point of this is really to empower mom. We're empowering her body through this beautiful process by removing interference and allowing that magic to happen. We're empowering her to have all the tools necessary no matter what her decision is for her birth process. If we can balance the structures and balance the nervous system, no matter what she decides to choose, we're here to support her, and her body can be at as much ease as possible through whatever her decision is. People ask me a lot, when should I come in to get adjusted in pregnancy? Is it before I get pregnant? Is it at pregnancy? Is it halfway through? Is it towards the end? And the answer is as soon as possible. What we want to do is cultivate an environment for growth in ease and not adaptation through dysfunction and discomfort. So if you're in the Louisville area or the Denver metro area, give us a call and we'd love to take care of you.